After the third time that he found out that he had come back, he said, "How many times am I going to dodge a bullet?" and I think that was, when you lose your parents and you only have one sibling left, that's my brother, it's kind of important. So gaining the 18 months that we did on the first trial was, we thought we dodged the bullet.
One of the nurses came in and says, "Dr. Senecal wants to see you." I went, oh boy, okay. So I went in there and he walks in just like he normally does. And he says, "John, the cancer's back." And I looked at him and I said, "So what do we do now?" And he goes, "Well, I think I've got something, but I'll be back with you on it."
This new therapy was just breaking news in December at our national hematology meetings and had some very impressive benefit to patients. So I knew if John recurred, I wanted him on this.
Well, it is a journey, and it can be a long one. I started in 2006 with my first melanoma. Then in 2009, I got another melanoma. And I started radiation and items like that. But the got more and more critical, and so Frank had a session with the family. This isn't easy. There were drugs usage trials in California, which I could have gone to. The immuno drug I took early on, which didn't work for me. So there weren't a lot of tools until Keytruda came up. And that was due to the research.
So last year, 2 weeks after Beer and Bites, I went in for scans and we had found out that my cancer had come back. And this time it had come back in my lungs, on the bone of one of my ribs, in the lymph nodes in my chest, which is a common place for this type of cancer to metastasize. So it was kind of a huge disappointment after being kind of in remission for as long as I had been. Dr. Senecal and the foundation, South Sound Care Foundation, sent me to genetic testing again with a different company. It's a more in-depth study of the cancer cells. People need to understand that genetic testing is extremely expensive, rarely covered by insurance, if ever covered by insurance. And so the genetic testing that I had done through the foundation was a considerable amount of money. I can't remember exactly, but we're talking $10,000, $20,000 just for me, just for one person. And there are so many people out there that need it. It's also opened up the door to other treatment options for me should this one stop working.
Eventually, all this data building up, the idea is to be able to find a cure for everyone, including those very, very bad patients. And this community is helping that sense.
The effort that goes into this is going to have an impact on our community, I think, for years to come. We're going to grow this organization. so that the South Sound is known for its clinical research, expertise, and ability. I'm asking you to continue to support us on that venture.
As a group of people who support South Sound, have to recognize that that's going to save a lot of people's lives. And that's why we do it.
Eventually, you kind of run out of options, and this is about my 8th line of chemotherapy or treatment. So I'm kind of one of those that are really far along the line of options for treatment. And so genetic testing keeps opening up more doors for people like me. And that's why it's so important that we have the ability to go through genetic testing.